A failed surgery left this woman unable to drink without it leaking from her nose. But how this surgeon fixed it might be the most satisfying thing you'll see today.
She developed some recession, so she was sent to a specialist who decided to graft the left lateral incisor site for a future implant. Unfortunately, the surgical site dehisced and the graft failed, and she developed a persistent hole from her mouth into her nose, otherwise known as an oronasal fistula. An attempt was made to close the fistula, but it was unsuccessful. She was then sent to me for treatment. On exam, there is a persistent oronasal fistula in the left maxillary vestibule. This fistula needs to be excised, and then this area needs to be closed in layers. The first step is to excise the fistula by incising and dissecting around its borders. Once I have freed the fistula and trimmed the epithelial layer, I invert the tissue and use it to recreate the floor of the nose. I close this with buried sutures. Now, I need a second layer of closure in the oral cavity. So I create an advancement flap using the labial mucoperiosteal tissue. I dissect superiorly to the point where I can bring this tissue over the defect with no tension. I advance the flap and it passively covers the defect with no tension. I want a primary watertight closure over the surgical site. Here is the final closure. The patient healed very well and was able to drink without liquid coming out of her nose immediately after the surgery. Thanks so much for watching. Please click those like and subscribe buttons and check out my channel for lots of interesting OMFS cases just like this one.